Burton v. Florida by Abby Price Berry. This case is an appeal on a pregnant patient at 25 weeks gestation due to being court-ordered to submit to any medical treatment necessary by her OBGYN. These treatments include bed rest, administration of IV meds, and possible delivery of her fetus. One of the stipulations was that she had to stop smoking even though she had been a chronic smoker for years. Is it ethical to hospitalize a pregnant woman against her will? Is it ethical to force a pregnant woman to stop smoking, take IV medications, and have an early C-section against her will? This case took place in the Tallahassee, Florida hospital. After the state attorney received notification from a healthcare provider that a patient refused medical treatment, the state attorney determined that Burton had to submit to the doctor's orders against her will. She was given one phone call with the judge from her bed and not given legal representation. 2 days after entry of the order, the appellant's deceased fetus was delivered by C-section. The patient felt that her rights were not being taken into consideration. She felt she was being forced to listen to her OB when she wanted to get a second opinion. Her fetus was delivered through C-section and her baby died. She was not given legal representation. The OB felt that the fetus was at risk. She was in a high-risk pregnancy, that Burton had failed to follow the physician's orders outside the hospital, resulting in her high-risk pregnancy. The OB stated that there was substantial and unacceptable risk of severe injury or death to the unborn child if bed rest was not implemented. The OB stated the ultimate welfare of the unborn child is the ultimate factor behind her decision. Social ethics deals with doing what is just, right, and what is good and bad in terms of human behavior. Was it unjust to force a pregnant woman to remain in the hospital against her will, quit smoking, and undergo a major surgery? Was the mother at the point in her pregnancy where the unborn child's rights were being taken away if she was allowed to leave the hospital? Should the patient have been held liable for the child if she refused treatment? Florida case precedent has addressed the right to privacy where a patient seeks to discontinue medical treatment, refuse a life-saving surgery, as well as a minor's decision whether or not to continue her pregnancy. Florida argued that the trial court initially found that the appellant had failed to follow doctor's orders. The trial court stated that as between parent and child, the ultimate welfare of the child is the controlling factor, and the state of Florida's interests were upheld at the time, and it was court-ordered that Burton had to comply with the doctor's orders. Later, after the decision was disputed, the court found that it was unconstitutional for the state to override a pregnant woman's decision about her medical care. Abortion is legal in the state of Florida. Burton was not given legal representation when she initially asked for it. This is unconstitutional. The court rejected Florida's case that the best interest of the child applied. There was no proof of viability of her fetus, and the least intrusive way to protect the fetus was supposed to be used. Autonomy applies in the patient's perspective because the patient was not free from external control or influence. Forcing a patient to stop smoking is taking away her independence and freedom of choice, as well as forced IV meds. Not allowing the patient to have legal representation is taking away her freedom of choice, and she has rights as a mother as well as rights as a patient. These were all taken away. Beneficence applies from the OB standpoint when she stated she was doing what was best in the welfare of the unborn child. In the doctor's mind, she was removing harm from the child and improving the situation of the patient in the long run by trying to save her baby. In the case of the patient, beneficence does not apply. The patient was being forced to do things against her will for the doctor's choice, and the patient was not given any choices and not being taken into consideration. Her baby dying caused emotional harm to her. Non-maleficence applies because doing no harm did not apply when the patient was forced to undergo a C-section where her baby died. Taking away her independence and freedom of choice did harm to her emotionally, physically, and mentally. In the end, the doctor and the hospital ended up doing harm to the mother as well as the unborn child. Nothing was fair in this case. It wasn't fair to make the patient stay in the hospital, judge her life choices with smoking, administer IV meds against her will. The state denying her request to leave the hospital was not right. Legislature found they didn't agree with what happened to the patient and changed their verdict. Justice was taken away from the patient throughout the whole process. The patient received her justice later when the court's decision was reversed in favor of the patient over the OB in the hospital. Burton, the unborn child, the OB, and the state of Florida all presented very compelling arguments. Although the court did not initially side with the patient, the case was reversed in the end. Legislature decided that it was unconstitutional to keep a pregnant woman against her will. It has been concluded that it is not ethical to force a woman to be hospitalized against her will, and it's not ethical to force someone to stop smoking against their will.